the approach will be, we'll go through the content of the presentation and the details. If you have questions, you can put them in the chat or in the Q&A. But at the end of the presentation, formal comments, we'll go around to everyone and ask for their comments and questions. So with that, Dr. Prerana, I'll turn it over to you. Thank you.
Perfect. Thank you so much, Larry. Hi, everybody. It's a pleasure to be here today. My name is Prerana. I'm very passionate about health and wellness and sort of the preventative side of the health and wellness spectrum. I have a background in health promotion in the context of individuals and populations, and then medical school, and then also a specialization in lifestyle medicine. And I'm here today to talk to you about patient empowerment and the paradigm shift. So let's get into it. So we are, I feel like, on a journey towards empowering patients to have ownership of their health and wellness. And I'd like to think of our health as a continuum with lots of interconnected factors that influence our health. And in the middle of this diagram here, you can see what is called the comfort zone. And I believe this zone is often the missed opportunity, because here is where patients can take more ownership to self-manage their disease. So what is ownership? Let's start with talking about that. So ownership is the act, state, or right of possessing something. And we all have the right to possess our health. We all are in a state of our own health. But when I say health, I'm curious what comes to mind. If people want to drop that in the chat, that'd be really cool. I'm curious. So when I say health or when I say wellness, what comes to your mind? Last time I asked a group of people this, I heard answers such as doctors, nurses, COVID, and the hospital. And I noticed that there was a lot of external factors that were listed when I asked to describe health. And rarely do we think of ourselves as possessing health. We might think that health is something we don't have because we're always used to talking about it in the context of disease or not having health. Or we might not understand that we can actually own the outcomes and that it doesn't always have to be dependent on our doctors, our nurses, our dietitians, or even our fitness instructors. And so that's why I believe this section is often the missed opportunity. This is also the section where physicians are not often able to address it to the best of their capacity. And that's because doctors are often trained more heavily on the poor health end of the spectrum, and we might not know how to help people help themselves. And this section requires an interdisciplinary care team. It requires personalized plans, adaptability, and numerous other factors that sometimes is not feasible for just the healthcare providers to take on. So we'll see how the average person can sort of enhance their efforts in this space and move towards the wellness developing side of the scale. And the wellness developers are likely already equipped at progressing their health, and they have this self-efficacy and this resilience. But the good news is everybody can move along the spectrum, and all it requires is a mindset shift and a little bit of connecting to yourself. So please feel free to drop your questions in the chat. Some of the concepts I'm talking about might be a little bit difficult to understand because it might seem a little bit more abstract. So before we get into it, let's take a step back and ask, why is all of this important? Why is patient empowerment important? And what exactly is behavior change? Again, please feel free to drop these answers in the chat. At the end, I'd love to go back and review it so that we can have a great discussion. But let's take a step to talk about what is behavior change. So behavior change is about altering our habits and behaviors for the long-term outcome. And the majority of research around health-related behaviors indicates that small changes can actually lead to enormous improvements in people's health and life expectancy. But it's difficult because when we think about a health behavior change, we're sort of overwhelmed with that process and we don't recognize that it's tiny little changes. It's not the one ice cream or the cake that you had at the birthday party that tipped you over and now you've been diagnosed with diabetes. No, it's over the years, the patterns and the way in which you were eating. So if you were repeatedly eating, cakes and ice cream and cookies all day, then that can influence your health. Same way, if you're trying to make a health behavior change, it's not going to be, oh, you joined a gym and you've gone for the one day. It's over time, small changes. And behavior change is at the core of lifestyle modifications. Changes in how we eat, how we engage in physical activity, how we cope with stress, and even how we think. These mindset shifts all can influence our health outcomes. And healthcare providers don't really receive the same standard of training when it comes to behavior change. And there's a lot of room for improvement. And again, this is very important because this is an important piece for patients. But patients can also play active roles in their health, and they can be active partners in their personal health. And it's a key driver when patients are part of their healthcare. That's a key driver to reducing healthcare costs, ensuring effective usage of resources, and ensuring that patient-provider satisfaction is present in the relationship, and then satisfaction, and then eventually the health outcomes as well. So managing chronic disease is truly a lifelong journey. And a chronic disease is any condition of long duration, and it's a result of genetic, physiologic, environmental, social factors. All of this play a role together, and you might need repeated visits with a healthcare team. Studies have shown that it can take a primary care provider roughly 10.6 hours per day to manage uncontrolled chronic disease in their clinic setting. So that's a crazy amount of time. And that is just for chronic disease. They still have to deal with the acute infections that come in, or the prescription refills that come in, or, someone's got the flu. So that is an unbelievable amount of time. And then if you also think about it as a patient, if you're entering your healthcare provider's office, if it's a doctor, you're probably seeing them for 10, 15 minutes if you're lucky. If you're seeing a psychologist, it might be a 1-hour visit. A dietitian might be an hour visit. But the rest of the time when you're at home by yourself, estimates about 99% of care is happening outside of the clinic setting. So it's really important for patients and people to understand this so that they can do more to help themselves. And so the evidence also shows that patient self-management, especially when supplemented with professional healthcare services, can enhance patient empowerment and lead to better health results. So just a quick raise of hands if anybody has ever embarked on a behavior change, and it can be health related. It doesn't have to be health related. Maybe you were trying to save money for a vacation. That's still a behavior change. You were decreasing your shopping. I'm just curious, feel free to drop it in the chat as well. Again, we can chat about that a little bit later. But here on the right side, I have a picture of the stages of behavior change. This is the trans theoretical model for behavior change. And I wanted to walk through this diagram. And so according to the trans theoretical model of change, there are different stages to behavior change, and we move through these stages sequentially, but at any point in time, we can also slip and go backwards on this stage as well, on this scale, sorry. And I like this diagram because even if you've reached the end and achieved this new behavior, there's still a possibility that you might relapse. And I'm just highlighting that to show that it's okay, because you can just as easily start the process again. And I think that's important, again, for us to understand that it's not about being perfect, but it's about making the small changes. So let's walk through the stages. So the first stage here we have is pre-contemplation. So for example, this is the stage when you're not even aware that there is a problem. So you might not be aware that you're living a sedentary lifestyle. Sedentary meaning you are not physically active. You spend most of your time sitting. Then you move on to the contemplation stage. This is when you're aware of the fact that your lifestyle is predominantly sedentary and you've become aware that this might be a problem, and you're thinking about making a change and becoming less sedentary. You're contemplating, okay, what do I have to give up? What do I have to adopt? Why am I sedentary? So you're thinking about all of these things. The next stage is preparation. And this is when you're intending to take action. So maybe you're looking to buy running shoes, or you've researched a gym in your neighborhood, or you're asking friends if they want to join a dance class with you. You're thinking about all these different things because you're preparing to take action. Next, we've got the action stage where you're actively engaged in the new desired behavior. So you've bought the running shoes and now you're walking to and from work instead of driving, or you signed up for that weekly salsa class, or you've now joined the aquafit class and you are engaged in that health behavior. Then we've got the maintenance stage. This is when you're sustaining that behavior for more than 6 months. So you've been taking weekly salsa classes and you've been going at this for 7 months, 8 months, or even just 6 months. And then lastly, there's always, as I mentioned, the potential to slip, and this is the relapse stage. And this is when you've reverted back to old patterns. Maybe you were doing really well for the spring and summer, and then winter hit and you're like, oh, I can no longer walk to work. And you're stuck in that limbo. You're back in that contemplation stage. Okay, what can I do for the winter months? But in that time, you've stopped going to the gym or engaging in that activity. And that's okay because life happens. But again, like I said, it's just as easy to get back on to the process. And I said it's the key word here, I think, is the steps, the baby steps, the one step you take each day. So let's dig a little bit deeper to understand what is motivating our behavior changes. So we're all striving to live long and healthy lives, but I'm curious if we've actually ever stopped to think about where this goal is coming from. And it's funny because I don't think we ever stopped to do this. And I was seeing a video on the internet. By no means was this a source of education. I was scrolling on Instagram, but there was this young girl asking her grandma, who's probably like 80, 90 years old, oh, grandma, like, do you want to live forever? And, and the grandma was saying, no, I don't want to live. All my friends are dead. I don't want to be here. And so it made me laugh because I was like, yeah, why do we always strive, to live long? What if we've lived a good, healthy life? Is it okay for us to want to end it, if we're getting old at an appropriate time? And again, I'm not talking about any mental health that's playing in effect, with thoughts of suicide, but just where did that goal come from? What motivates us to be healthy? Who set these goals? Was it your doctor? Was it society? Or is it something that you desire inherently? And so there are a lot of intricate factors that we need to consider, and unraveling all these intricacies to understand what drives us requires us to connect with ourselves. And what do I mean by connecting with ourselves? So I'm talking about identifying what strengths you possess, what values you live by, what is important to you, what is your sense of purpose in life, what is your why, why are you getting up every day, what emotions do you experience frequently, what brings you joy, what are your dislikes, and the list literally goes on. And this is where I'm saying it gets a little abstract, because you might be wondering, how does this tie into health? And what I've actually noticed is oftentimes when we get connected with ourselves, we're more likely to engage in behaviors that make us feel happy, and we might not be fixated on the health outcome specifically. So we'll get into that. So in order to engage in a behavior change and maintain positive health habits, we need autonomy, competence, and relatedness. And I think competence is a key factor, in my opinion, and that is, how confident are you feeling in your ability to make this behavior change? Even outside of health, How confident are you in yourself, in your ability to cope with life? What are you sure of about yourself? What do you do well? So, when I was studying for my lifestyle medicine boards, I came across this interesting statistic that only 1 in 3 Americans can identify their strengths. But when we think about our flaws, I think we're so quick to state what our flaws are. So, you might be at a work meeting and you say, "Oh, I'm not going to lie, I'm actually quite creative," or "I'm not going to lie, I cook really well." Why is it that we have to preface something positive that we want to say about ourselves with, "I'm not going to lie," or, as a form of humility or a shyness, or just the sense of not fully embracing our strengths? So I'm curious about where that comes from. I feel like you have to feel good about your skills and your competency, because that is what's going to continue to drive you on this lifelong journey of health. And when we're talking about chronic diseases such as diabetes, they're often known as progressive conditions, meaning even if you are doing the best that you can be doing, the disease is still progressive, meaning the state is going to get worse and worse. And so the goal here is to sort of reduce that progression or better manage that disease as it progresses. So it really is a journey that we have to be willing to take. And then we've got relatedness. I think humans need to feel a sense of belonging and connecting with others and having this larger sense of purpose in life. And that has actually been linked to health outcomes. Having a strong sense of purpose in life is important in mitigating disease and promoting longevity. So, studies have shown that people who have a high sense of purpose in life were less likely to be diagnosed with Alzheimer's disease. They were less likely to have cognitive decline. Those with a chronic medical condition fared better if they had a strong sense of purpose in life and strong positive relationships in life. Our inflammatory markers in our brain, such as C-reactive protein and interleukin 6, those levels are actually lower in our bodies when we have a strong sense of purpose or relatedness. And when we become ill, those who had a strong sense of purpose were actually quicker to recovery, and they were actually better able to cope with life stressors. And then, in addition to understanding our purpose in life and getting connected with ourselves, studies have also shown that studies have shown that if we're not able to identify our emotions, then we can get into this negative emotional state. And that negative emotional state will then turn into negative health behaviors. And they actually did a study during the pandemic in Italy, which I thought was very interesting. It was published in the Journal of Appetite, which is an international research journal that specializes in cultural, social, psychological influences on food intake. And they published a study in 2021. And the study showed that during the lockdowns in the early parts of the pandemic in Italy, where there were strict restrictions, there was worsened quality of life, lots of social isolation. Of course, we all felt it. And so naturally, there was a lot of stress. And what they found is during this strict lockdown period, those who had a higher BMI and those who had difficulty identifying their emotions, which is in psychiatry and medical terminology, it's a term called alexithymia. So those who had higher BMIs and more difficulty identifying their emotions were more likely to engage in emotional eating. They also noticed in the second half of the lockdown, when the restrictions were lessened, there was a little bit more social connectedness, then there was a decrease in emotional eating. So I find that very interesting. And I think the pandemic really showed that to everybody. We were in a state of frenzy. I remember seeing on the news, everybody was buying sugar and flour and baking at home all day. And I think that has a lot to do with the fear that we were feeling, and we didn't know how to make sense of it. And so we needed all that dopamine and that feel-good hormones that are released from the sugary foods. And so if we're not tuned into how we're feeling, it's easy to live on autopilot and tap into poor behaviors. Think about the last time you might have been stressed at work, and it's a stressful day and you just don't even want to think about your job. You might end up going out with your colleagues for happy hour, and then you're just sort of drinking your worries away. But you're not thinking that you're drinking your worries away, because it's a drink here and a drink there. But again, like I said, over time, if you're a stressful CEO and this is how you're spending every day after work, then those patterns are not going to be the most helpful. So we can, when we're diagnosed with chronic disease, we are automatically in this state of stress and shock. And this is why it's even more important in this space to tap into how we're feeling and connect with ourselves. Sometimes we can even ignore the diagnosis altogether, and we might feel the sense of panic that we have to change everything right now. And then our body goes into that fight, flight, or freeze. And so it becomes really overwhelming. So if we start ahead of time with evaluating how we feel in a healthier state or in the present state, and we're connected with what is motivating us to change, what our strengths are, why we are interested in certain health behaviors, then if we do encounter distress or disease, then we'll be able to better cope. And all of these tools will be more readily available for us. And so we won't feel so overwhelmed. So let's look at this diagram over here where we are talking about intrinsic and extrinsic motivators. So extrinsic motivators are things external to us. And I think when it comes to health, one of the biggest extrinsic motivators is fear of failure or fear of punishment. You see that listed in the diagram here. And in the context of health, the ultimate fear is if you fail to take care of your health, you could get a heart attack. If you fail to take care of your health, you could die. Or the punishment is this disease or cancer that you have to live with now. Or maybe we are focused on the rewards. So somebody that might be a little bit overweight, they might want to lose weight to get cool points from society. Again, something external to us. It's not internal to us. But if we aren't asking the deeper and harder questions about what does it mean to be a certain weight, or if we're not getting curious about why we're exercising or not exercising, or if we're not trying to understand if we enjoy running on a treadmill or if we enjoy going for a walk every evening, if we're not tapping into these deeper emotional states, then we won't be able to sustain this long-term change. And then the third piece is autonomy. I have options. So are you autonomous with your decision making? Are you exercising now because the doctor said you had to lose weight and manage your diabetes and blood pressure? Have you learned what actually does exercise mean? And have you understood the different types of exercise that is available to you, and you can pick the one you want to? Or are you now just running to the gym because everyone thinks exercise and then you associate it to the gym? And now you're just, again, like I said, living on autopilot. So I'm curious, again, please feel free to drop your comments in the chat. But now if we look over into the intrinsic side, there are different things that are listed here. And I'm curious if anyone, again, has examples of intrinsic motivation that has driven their behavior change. So again, is your doctor telling you to exercise and you hit the gym? Or are you pausing to think about the desires and solutions that you want to bring in? So let's say you are overweight and your doctor is saying that you need to exercise and eat healthy. If you pause to think about what is driving you internally, you might come to find you love being in nature and chatting with other people. You're a social butterfly. So now you start to search up activities such as a hiking group, and you do mini hikes on the weekends. So now you're achieving three things. You're achieving physical activity, but it doesn't feel like a daunting exercise because you like to be in nature. You're getting that sense of belonging. You get to be the social butterfly and interact with like-minded people. And now you're engaging in things that you love. Eventually, over time, and I'll get to it in the next slide, you'll see how that will also translate into positive health outcomes, because if you continue to go on weekly hikes, you will eventually lose weight. That's just physiology. That's just how your body works. But it's not going to feel like homework or exercise or gym. So intrinsic motivation is the best for long-term change. And you'll see this on the diagram here, the arrow at the very top. And this involves that inherent sense of satisfaction and fun. And it can even be challenging, but you're thriving off of this challenge. So for example, that person that joins the hiking club, initially, it could even be a monthly hiking club because it brings them joy. But then the sensation will be a driving factor for them to maintain that feeling of fun. So now it has the potential to grow. So now maybe the monthly hiking club has now turned into a weekly hiking club because they found people in their area and they don't have to drive to some far off mountain or forest. And now they're just going on hikes nearby. And maybe this group now as a club wants to hike Mount Everest, and they've made that goal for themselves 3 years down the line. And now inherently, everybody in the group is excited about training for this Mount Everest hike. So they naturally find themselves now going into the gym to train. So they've now progressed and they've started off with something inherently fun that brings them joy. And now going to the gym is also going to bring them joy because, again, it's still tied to their values of being in nature and hiking mountains and having different life experiences. So are you sort of seeing how these positive behaviors are now compounding on one another? Just a hand raise would be cool to just acknowledge that. So now you've turned it into a process and it's a journey and it's not just your end goal. And so now this is touching on the concept of eudaimonia and hedonia. And these are very interesting terms. The term eudaimonia comes from Aristotle, and Dr. Barbara Fredrickson out of UNC Chapel Hill has actually done lots of research on positive emotions and eudaimonia. So eudaimonia means discovering meaning and purpose in order to find what nourishes us and fills us with deep satisfaction and gives us that purpose in life. So to sum it up, it's living our best lives, right? So that's eudaimonia. And this process, if you're following eudaimonia, well-being isn't an outcome or an end state, and it's a process. And research has shown that those who are engaging in eudaimonia actually decrease their inflammation and they're improving their body's immunity. By contrary, we have hedonia, which is the pleasure-seeking behavior largely for its own sake. So for example, eudaimonia would be learning how to bake for the purposes of indulging in a creative process. You want to learn a new skill. You're curious about baking with different ingredients, flour, oatmeal, keto, almond flour, all different type of baking ingredients. Some of them can be healthy, some of them can be unhealthy, but you're engaging in this process. And then at the end of it, yes, you do get a sweet treat, but that's not your focus. Whereas hedonia is you're buying a donut because you want that quick fix of sugar. You might have had a negative emotion. You might not even be aware you had a negative emotion that drove you to getting a donut to make you feel good. But here you are now tapping into hedonia. And so hedonia, this is when you're focused on well-being that's actually created by maximizing your happiness. And it's actually avoiding negative emotions. And it's focusing on the satisfaction of your desires. You're feeling sad, you desire to be happy, you're having a craving for food, and you're just getting it, and you're getting that fix. This type of behavior or lifestyle worsens inflammation and decreases your immunity. And so when you're thinking about any behavior, even, let's say even something such as gambling, are you in the casinos gambling because you're now strapped for money, you're experiencing all these negative emotions, or you sort of want to win big and have that rush of happiness and just be rich? Or did you watch a movie about gambling and you were so curious about math and probability and you were like, oh, I was good at math back in the day, and you're wondering how card counting works and you want to learn, all the intellectual components of gambling. Or maybe you want to go to fancy hotels and fancy casinos because you like to dress up and have a good night out. If that's what's driving you to go and experience gambling, then you're less likely to become addicted to that behavior. So I hope you're able to sort of see the difference. So now when we're talking about this in the context of motivation, you can see that there's a correlation with intrinsic motivation, where you find fun, interest, and enjoyment. And that relates to eudaimonia, with this feeling of intrinsically being motivated to do certain things. You're living life to your fullest potential. So that's you joining the hiking club because you want to spend time in nature and you like walking. And then you're not focused on the end goal of losing weight, which is what your doctor told you to do. So now sorry, I'm just taking a look at my notes over here. So if we get into the habit about slowly thinking about what's driving us internally and connecting with ourselves, then we can slowly move through the different types of motivation and get into this long-term change. So I actually had a professor that was diagnosed with type 2 diabetes, and he loved to dance and he loved to listen to Toni Braxton. So every morning at 4 a.m., he woke up and he put on the music and he just danced in his bedroom. And that was how he was able to maintain his diabetes just on metformin for a number of years. Again, as he got older, yes, disease does progress. So he did eventually have to take a second medication, but just 2 medications for a lifetime of type 2 diabetes is quite an impressive thing. And so then we've got on the diagram below, we're talking about patient empowerment. So I know that's a pretty big buzzword these days, but what exactly does empowerment mean? So within the healthcare field, patient empowerment relates to a patient's increase of knowledge, skills, attitudes, or self-awareness, combined with the confidence to participate in their care. And there's actually a shift in the balance of power here, from the healthcare provider always having the power to now you as the individual or as the patient taking some of that power back. So empowerment is the increase of knowledge, skills, attitudes, or even self-awareness in the context of health. So again, here the focus is shifting to activities and inputs that can help increase your motivation. So now this slide is super busy, but I'm going to break it down a little bit. So as I mentioned, chronic disease is a journey. It's a process. It takes time and it's not immediate. And there are a lot of different factors that influence this. And they've actually done studies to sort of map this out. And that's why you're sort of seeing this concept map here, and it gets quite busy. So yes, there is a huge self-management component, but how do we get there? And what is the healthcare provider's role and what is the individual's role? So you'll see over here that in the top half of the diagram, that healthcare providers are responsible for delivering patient-centered care. And the Institute of Medicine defines patient-centered care as respectful, so that's care that is respectful of and responsive to the preferences and needs and values of the individual. And it's interesting because here itself, you'll see preferences, needs, and values of the individual. If you as the individual are not even aware of your preferences, needs, or values, how are you going to communicate that to your healthcare provider? And how is that healthcare provider then going to use that to be therapeutically beneficial? So healthcare providers are supposed to deliver patient-centered care. They're supposed to be mindful of your individual needs and values. And this can actually enhance patient empowerment. But it is not necessary and it's not a precursor. That is, I think, very interesting. And that's what this paper outlines, that individuals can actually empower themselves, and you don't need to have patient-centered care to be able to feel empowered. So patient participation is the next concept I want to talk about. Patient participation is when the patient obtains sufficient, appropriate, understandable, and meaningful information and knowledge to feel confident in their health. So this is where the individual is gathering this relatable and understandable information as it relates to their individual health. This is necessary for empowerment. It enhances empowerment, and this is necessary for the person to feel like they can participate in their health. Then we have self-management, and self-management in healthcare refers to an individual's ability to manage their symptoms, treatments, physical and psychological consequences, and all the lifestyle changes that go along with a chronic disease. And so being able to self-manage your condition requires patient empowerment. So you'll see it's sort of like a step-by-step process. And then we've got patient engagement. And we're going to talk about this in the next slide as well. And I think this is one of the most important things. How do you get patients engaged? So patient engagement requires personalization. For me to be engaged in my health, I cannot receive a general recommendation. My healthcare provider can't tell me the same thing that they're telling you or the next person. Or when I'm reading one website, that might not be resonating with me, but it might resonate with somebody else. So patient engagement requires personalization. It requires the patient to feel confident in their ability. So this, again, like I said, it goes back to you feeling, what are your strengths? What are you engaging in? It also requires a commitment and a willingness on the patient's side. And then it requires a strong therapeutic alliance. So here we're seeing strong therapeutic alliance that's involving another individual. But the rest of the things are largely on the individual or the patient. But again, websites, government agencies, policy creators, they also need to be aware that they need to maybe personalize recommendations or create recommendations that are applicable to a large body of people. So patient engagement is relatively a newer concept, and we're gonna get into the next slide here. So right now, there's a bit of a problem because there's actually not a lot of resources that are tailoring to this. So that leaves us in this current state of care where the individual is feeling completely isolated. Healthcare providers are working in silos. There are static resources, and it's just not structured. And there's just general recommendations, general handouts, and some occasional touch points with our clinicians. Naturally, anybody is going to start feeling overwhelmed. So chronic disease costs a lot of money. Seeing health coaches and individual providers is also going to be costly, and it might not be sustainable or feasible in the long term. So we haven't actually yet been able to identify how we can provide this type of structure that we get in the clinic setting to individuals on a level that's scalable. And so that's kind of the gap in care we're all experiencing here right now. But there is a paradigm shift. Patients are already understanding that they don't need to wait for their doctor to give them that sense of control to make them feel empowered. Patients are actually empowering themselves. They're out looking on the websites, they're looking for activities that bring them joy, and they're getting in touch with themselves, and then they're bringing it to their doctors. That's actually a paradigm shift that I'm noticing. And individuals can do a whole host of different things to empower themselves. They can learn cognitive behavioral techniques to deal with the outside pressures of life, or deal with coping with failures in life, or trying to learn how to gain a sense of control and process some negative emotions. So that can be done with cognitive behavioral therapy. You can lean into social support groups that help you build accountability or engage in some friendly competition and feel that sense of encouragement to live well. Or they are starting to get involved in community and employee programs that are supporting healthy behavior change. Then also there's been a shift in the healthcare space to leverage digital technology that can assist with behavior tracking and help with fostering sustainable behavior change. And then, of course, lastly, they can connect with themselves to become aware of their values and focus on their strengths and their skills. And this slide here is talking about MyViva, the organization that I'm currently working with. We are a lifestyle medicine-based company for chronic disease management. And here we are using technology, but why I love, working for MyViva is because we're actually able to provide that personalized treatment plan where we're focusing on individual needs. If someone's vegetarian and they want vegetarian meal plans, or if someone's got knee pain and they want to modify their workout, our digital platform allows for that. And I think when you're in search of a digital tool, it's important to do a little research, find one that you feel good about, and then find one that keeps you connected with your care team. Because as I was mentioning earlier, doing self-management on your own, but having that supplemented with a healthcare team will actually improve health outcomes. And so that's why I love the team that I work with. We're delivering that coordinated care where we've got the physicians or the healthcare providers, we've got the patients, then we've got the MyViva plan, the digital platform. And this enables us to stay in that community of care, and it incorporates both intrinsic and extrinsic motivation as well. But if you need a magic bullet for success for health and wellness, then I suggest you get into the PERMA model. This is a concept that is described in positive psychology. Positive psychology is the scientific study of your strengths and virtues, and it requires you experiencing contentment with your past, happiness in the present, and hope for the future. And it focuses on your strengths and your virtues, and it's a recipe for wellness. So let's say that someone has been, diagnosed with type 2 diabetes, or they've been diagnosed with cancer. You've got to sort of make peace with the past, right? Move away from blaming yourself. Oh, I shouldn't have eaten all those cookies, or I should have, not done this, or I shouldn't have smoked and I wouldn't have gotten cancer. Yes, we need to reconcile the past. We need to find ways to experience happiness in the present, because there's always going to be dissatisfaction. There's always going to be stress, but we don't need to go into unnecessary suffering, meaning trying to avoid negative emotions. Instead, our goals should be learning to cope with all of our emotions, and we will learn that we can actually find happiness in the present. And then hope for the future. Yes, I have been diagnosed with this condition, but I am hopeful that if I engage in the right behaviors and have a supportive team, that I will get better. So Martin Seligman is the father of positive psychology. He's created this PERMA model, and proactively working on components of the PERMA model not only increase well-being, but also decreases psychological distress. And so this involves engaging in activities that bring about positive emotions, having that sense of engagement in life, right? So maybe you are enjoying baking with your kids. This is bringing you positive emotions. You're fully engaged in that activity. Engagement in the space of positive psychology is considered rewardingly tiring. Your challenge level is high, but your skill level is also high. So, you might not know how to bake, or it might be chaotic to sort of get your whole family together to sort of bake together or cook together. But at the end of it, you feel good and you're tired, but you've got this sense of accomplishment, which is the A in the PERMA model. And then positive relationships. Are you engaging with colleagues, friends, and family that are positive and uplifting? Are you engaging with people that have like-minded health outlooks? Or are you engaging with people that have poor coping or poor lifestyle choices? And are you doing things that bring meaning to your life? You know, are you eating a strict diet of just salad all day? Or are you doing something meaningful like cooking a meal with your family and connecting time with your family? So here you've branching out from the direct, intricate focus of health into larger concepts, but then the end outcome will still be health. And so the transformative journey, I wanted to just quickly go on a journey with an example, but I do have some worksheets here. But I had a patient one time, a 35-year-old woman with type 2 diabetes. She was a senior leader in a large marketing firm. She was happily married with 2 kids, aged 3 and 5. And her doctor had recommended that she just diet and exercise to control her blood sugars. And when I was connecting with her at a different clinic, I asked her, what would be possible for you if you lost weight? And her response to me was, oh, I could actually find pretty clothes to wear, and I could go hang out with my colleagues after work. Right now, she was sort of not hanging out with colleagues after work because she didn't have any clothes that fit her nicely. And so that was not a priority for her, and she wasn't feeling good about herself. Also, she has 2 kids, and she felt guilty that if she took time outside of work to go exercise or do something else, then she was a bad mom. So all of these factors were sort of getting in the way of her making that health behavior change. So we got to go through a series of worksheets. Number 1 is identifying your strengths. And if you're having trouble identifying your strengths, like most people do, there is a nice survey on this website. It's free. And at the end of it, you get a nice little description of your actual strengths. And I think it's really great. I encourage you all to go take a look. But let's say that your strength is actually leadership, and now you want to be the leader in your local neighborhood, and you want to start a walking group for your mom's club. So for example, Marley could do that on the weekends. She's noticed in her neighborhood there's a bunch of moms that all want to live healthy, but they find it difficult. So she takes the leadership, honing in on her strength, to just put up a poster on the mailbox and say, hey, every Saturday we'll walk our kids to the park. And that's her way of incorporating physical activity. She doesn't have to go to the gym after work and, strive to lose weight. So that's using your strengths to work for you. Then the next worksheet is figuring out what your values are. And I've termed it what your vibes are. So your values are influenced from your primary caregivers. So what messages or information did your primary caregiver, your mom, your dad, whoever took care of you, what was their value system based on health? Did they say, we have to eat whole foods at home? Or did you grow up in a family that ate a lot of meat and processed foods? What messages did you receive from them? What about your friend circle? What about your society? What about your cultural heritage? Some cultures actually value a larger weight, whereas others don't. So identify what messages you received from all of those, identify what values are important to you, and then sort of bridge the two and find that light within yourself, self-awareness, find your value system. And then lastly, we all know we have to set SMART goals. Be specific with your goals, make sure they're measurable, achievable, realistic, and timely. And then engage in this possibilities of change worksheet. So change is very difficult. You have to map out, and I would recommend you literally writing it out. What is possible in your present state of health? What is not possible in your present state of health? Then shift over to the other side, and in your new desired state, what is possible? So what would be possible for you if you've lost 20 pounds? So for Marley, it was, I can now socialize with friends at work. And what is not possible? And then you've got to identify the things in the middle. So what behaviors and thought patterns do you have to let go of to help you transition to a new state? And what behaviors or thought patterns do you now need to adopt to help you transition to the new state? It sounds overwhelming, but there's a lot of these worksheets. And again, this all goes back to taking time to connect with yourself, working through this, figuring out what's important to you so that you can feel empowered to take ownership of your health. And so that brings me to the end. Thank you all so much for listening. I'm going to pause there. Hopefully we didn't run over time. And then I'm open for questions.
No, I think Dr. Prerana, thank you so much. We are good on time, and there is one question. We do have one question in the question box here, so it's just related to, looking at healthy behaviors as it relates to, fear of death versus, living the life that you want to live. And so I think there's a reference to an Ernest Becker book here, but do you have any comments on, kind of what motivates healthy behaviors as it relates to, what we want versus what we fear?
Yeah. Oh, I love that. And that's exactly it. So when we're talking about health, we're not actually talking about health as owning it. We're actually talking about health as if it's like a state we're trying to constantly get to. And we identify with being not in a state of health, which I think is really interesting. And that's why I was saying it's that mindset shift, right? So if you, and it's funny because our brains actually are better at understanding positive framings of words. Even if you're talking about eating, if you say every morning for breakfast, I'm going to add an apple, your brain will be able to process that as opposed to, I'm going to stop drinking Starbucks every morning, part of my breakfast, right? So it's very interesting. And I actually haven't read that book, so I have to take a look at that. And yeah, fear of death. And this is a very like philosophical topic we're getting into now, but fear of death is definitely a motivator. And I sometimes wonder, why are we so scared of death? And I think we're scared because, again, we're fixated on what we have not done. Oh my gosh, I can't die because I haven't done X, Y, Z, and I have all these things I want to do. Whereas if instead you're daily focusing on what you want to do. Oh, I want to go on a vacation next year, so I'm going to work to do that. Or I want to live healthier and drink more water, and you're getting into doing that, then I think you'll be less likely to have that fear mindset. And you're not going to be so scared because if life did end, you were at least working along your way to the life you wanted, right? So, yeah.
That's great commentary. Appreciate that. And I'll just remind our audience, if you have questions, you can type them into the chat box. You can type them into the Q&A box. Or if you'd like to ask a direct question to Dr. Prerana, just raise your hand and we can open up your microphone to ask a question.
No problem. I'm seeing a thing here. Yeah. So we are motivated by what makes us feel good. The key then is to realize the beauty of healthy behaviors feeling as good or hopefully better than bad habits. Yep, exactly. I'm not going to lie to you. That donut feels really good, right? And that's just because physiologically, all of that dopamine hit that we get from eating that, it makes us feel good. But let's take a look at, you might have internal dialogue. Oh, I want to eat something sweet, and okay, maybe I'll get a donut. Maybe I shouldn't. You get the donut, you eat the donut, you feel good in the 5 minutes it takes to eat the donut. But how do you feel 10 minutes later? You're walking home, you're like, oh man, I shouldn't eat the donut. Now I got to walk, an extra 20 minutes. And so true feelings of happiness are sustained. And what happens when you engage in these types of behaviors is with addictions and things like that, the dopamine hike that you get. So we're all at a baseline level of dopamine, right? And then we take a donut, we might do some cocaine, whatever it is, our dopamine level shoots up. But when we're coming down from that, the dopamine level actually dips below our baseline. So now we end up feeling worse than that. And they've actually shown that with cocaine. And then they've compared it to cold plunging or immersing yourself in a bucket of cold water. I don't know if you've heard that recently, but that's become a health behavior or fad or whatever that's happening. But that's because being in that state of cold also shoots up your dopamine. But then when you're coming off of it, you're not dipping below what your baseline was. And so it is very difficult. So anytime you're thinking about getting into eating a donut or doing something negative for your health, ask, why are you engaging in this? And take a moment to lean into it and see if this is hedonic or eudaimonia that you're tapping into, and slowly try and see. And it's okay if you want to eat a donut. If you go from eating a donut to now you're eating a donut made with almond flour or something else, and you engaged in the act of making the donut yourself at home, that's awesome. That's a great step.
Well, thanks again, Dr. Prerana. I know that at the conclusion of this call, I'm going to Google PERMA and do some reading up on that and learn a little bit more. I thought that was wonderful, and appreciate our audience today. Thank you so much for presenting. Just for our members, please know this has been recorded. We will post this in the members only section of NAWHC. Dr. Prerana, thank you again so much, and that will conclude today's meeting.
Perfect. Thank you so much. Bye.
Have a great day, everyone.